Hello, today I'd like to discuss the dangers of consuming 10,000 IU of vitamin D3. 10,000 seems like a lot. Is it really that much, though? IUS is for international units, just so you know. As a result, 10,000 international units of vitamin D are comparable to less than 1 milligram, or even 0.5 milligrams. Actually, it is 250 micrograms, or 1/25th of a milligram, or 0.25 milligrams. 10,000 international units of vitamin D3 are contained in it. So, is it dangerous to take that much? I believe that not taking that much is riskier. The vast majority of us are vitamin D deficient. Now, suppose the contradictory information is that the recommended daily allowances, RDAs, for vitamin D range from 600 to 800 international units. And now that we're talking about taking 10,000, the difference seems too much. We must understand, however, that the 600 to 800 IUs are based on outdated studies on osteoporosis prevention and bone loss. It has not been updated to include all the most recent findings regarding the immune system's benefits of vitamin D. What's more stranger is that vitamin D is actually a hormone, not a vitamin, and that it has anti-inflammatory properties remarkably similar to cortisol. Every cell in your body contains receptors for vitamin D even without the adverse effects. The uses for vitamin D are incredibly varied. However, we must primary emphasis on the need for a maintenance dose. 10,000 IUS. The absorption barriers are the true issue. Numerous factors exist that prevent your body from absorbing vitamin D. Right. We have one big source: sun for vitamin, but people don't go outside as much, so their skin doesn't receive enough sun exposure. You won't even come close to acquiring the amount you need. It is quite difficult to consume enough vitamin D from our diets. You still won't get the levels you need even if you consume foods high in vitamin D3, such as fatty fish, cod liver oil, and egg yolks. Then there are some who are overweight. Metabolic syndrome is a condition in which the amount of fat directly beneath the skin makes it more difficult for the sun to penetrate and produce the essential vitamin D. Vitamin D doesn't absorb effectively if you have diabetes or insulin resistance, and as you get older, your skin becomes thicker, making it more difficult to absorb vitamin D. The greater your pigmentation, the less your ability to absorb vitamin D. Additionally, the more issues you have with your liver or gallbladder. If you have a fatty liver, you're going to have less vitamin D absorption because you need bile to help you absorb vitamin D from food and supplements because it's a fat-sized vitamin. And if you have more kidney issues, you're going to have less vitamin D as well. Therefore, the process involves converting these precursor, or inactive, vitamin D molecules into the active form of vitamin D through a number of processes. But in order to obtain this active form of vitamin D3, you must first pass via the liver and then the kidneys. After that, it must be absorbed into your receptors. And they are known as vitamin D receptors. Additionally, viruses can degrade receptors in your body to mislead your body into not absorbing vitamin D3 if you have an infection, such as a viral infection. That presents another obstacle. The amount of vitamin D you'll require will have to be much higher to overcome the resistance that the virus has purposefully generated for you if you have an immune system disorder or weakened immunity. And when they perform a vitamin D blood test, they test the inactive form of the vitamin rather than the active form. And the reason why is that there are a lot of issues with it if they tested the active form. First of all, it has a very short half-life. I believe it takes between 4 and 6 hours as opposed to 2 to 3 weeks for the inactive vitamin D3. Additionally, vitamin D3's active version has 1,000 times less of it than its inactive counterpart. Evidently, you have a lot of vitamin D that is not active but is ready to be transformed. Additionally, your body will produce more of the active form of vitamin D3 to make up for any deficiencies in the inactive form. So it doesn't really tell you much if you test for active vitamin D3 and it comes out normal. The liver is where this gene undergoes one of the two stages that turn it from dormant to active. Therefore, if you have an issue with this gene, you'll have trouble turning the inactive form of the protein into the active form. Therefore, as a preventative measure, consuming 2.5 liters of fluid every day significantly lowers your risk of developing kidney stones because you'll keep the urine diluted. And then on top of that, if you add in some of the foods that facilitate vitamin D's action and absorption. Additionally, there are components that guard against hypercalcemia, such as vitamin K2, magnesium B6, and zinc. Then you are even more in a safe zone. One other thing, there is still no agreement among the medical profession as a whole as to what those levels should be when it comes to having your blood tested for vitamin D. The average doctor has a concentration of 100 to 50 to 200 nanograms per milliliter. However, when they perform a blood test, they only check for inactive vitamin D, they do not check for active vitamin D, and they also do not check for the level of vitamin D receptor absorption into your cells. If you also have a hereditary vitamin D receptor issue, an infection or virus that is degrading your vitamin D receptor, or even an autoimmune condition, you may have a vitamin D receptor that is degrading.